Hello, this is Dr. Gay from First Look MRI, and this is a 42-year-old male with complaints of knee swelling and pain. He's got an MRI of his right knee here, and he has a prominent synovial inflammatory process. So if we look at the knee here, we see complete loss of the cartilage. Normally there's a thick rind of cartilage keeping the bone separated, but in him there's no cartilage, it's completely gone. You see fluid, and then the dark black line is the cortex, and the cortex also is eroded, and there's an erosion right here, subchondral meridema, cystic changes. So advanced erosive changes or moderately advanced erosive changes related to chondromalacia. Out here we also see complete loss of cartilage, bone-on-bone appearance, so a prominent synovial inflammatory process. If we look in the sagittal view here, we see that there's fluid in the front of the knee here, complex fluid, and these little nodular things are synovial inflammation or synovitis. We can see them over here in the lateral side, look like little rice bodies. So advanced diffuse synovitis, and we see an erosion out here. It shows up better on this view. So this is a view called a coronal T1 view, and we see what looks to be like a little bite, like a mouse took a bite out of right here. Also a similar little marginal erosion here. And when we see erosions that are away from the joint off to the side, especially in a male, we think of gout. So this is probably a case of gout. Psoriatic arthritis also could produce this, so we throw that into the differential. But in a case like this where we see complete loss of cartilage, erosive changes, and then these enthesopathic erosive changes where tendons and ligaments attach. Here we have the joint capsule comes down and attaches there, so it's right where the joint capsule attaches. The capsule is inflamed and it starts to erode the bone slowly. Same here, the popliteus tendon comes up here, right where it attaches, it erodes that, and we get these classic erosive changes that are away from the joint. So this is a case of an advanced synovial inflammatory process, probably gout, although psoriatic arthritis could do that. And that's it. Thank you very much.